Today on Talking Solutions Diabetes Awareness, we need to talk about the subject. I want to welcome Rayleen Earney from Southern Nevada Health District. What role do you play with the Health District?
I'm a health educator there in the Office of Chronic Disease Prevention and Health Promotion. So I try to keep people well.
I like the prevention angle. I love this website with Southern Nevada Health District and have followed Get Healthy Clark County for a number of years. There is so much on there. And as it is the holidays, what a great time to talk about diabetes, because there's no way that you could be in any kind of a gathering and not have someone in that group who is experiencing type 2 diabetes.
Absolutely. And it's a wonderful way, like you said, for people to gather, have a good time, but also be concerned about each other's health and just help them with those resources. You have your own support system in your family and friends, and what better way to know what those resources are?
I've been really lucky. There was a time a couple of years ago when my doctor had said, we want to keep an eye on your A1C levels. And I know that that's one of the things in a blood test that starts to tell us where someone's health stands when it comes to diabetes.
That's right. We need to know our ABCs, and the A1C is certainly the A in those ABCs. And that's the first indicator. Some people know that they have an issue with their blood glucose. Maybe it's a bit high. And that's your average blood glucose for the last 2 to 3 months. So it's always great to go to your healthcare provider and ask them to run those tests, especially if diabetes runs in your family.
I've heard type 2 diabetes referred to as epidemic, and I've always heard that there are factors, things like obesity, lack of movement, our food intake, things of that nature certainly are things that we can take steps to help ourselves as far as trying to prevent or to manage type 2 diabetes, for instance.
Absolutely. And even our age, being 45 years and older certainly is a predictor too. It gives us more risk factor for developing type 2 diabetes. But all those lifestyle things are certainly a key. So what we try to focus on at the Southern Nevada Health District is getting people to eat better, maybe eat on a smaller dinner plate, 9-inch size rather than a platter. And we go to restaurants a lot, so we know that some of those plate sizes are large, but we can box up half of our meals. Also, eating more fruits and vegetables. People aren't eating enough vegetables, and we say half the plate should be vegetables. We're just not meeting that requirement. Getting that physical activity at least 30 minutes a day, 5 days a week at least. And if you can't do 30 minutes at one time, do the small things. Walk around while you're talking on your cell phone, park further out from the grocery store, even while you're out there holiday shopping. Those are some tips that people can do. And I think what happens too, Terry, is people don't realize it's those small steps that really lead to those big rewards, such as if a person's overweight, like you had mentioned, sometimes people make their goals too large. They think, I have to lose a lot of weight or something like that. But really, losing just 5 to 7% of their body weight, and that's 10 to 15 pounds for someone who weighs 200 pounds, for example, that could really make a big difference in their blood glucose levels and just their overall health.
No doubt about it. I heard years ago that if, for instance, you take off 10 pounds of weight off your frame, that you've taken about 40 pounds of pressure off of your knees.
That's incredible.
It makes a big difference. I think it's important to know that the diagnosis of type 2 diabetes, it's not a death sentence. It's something that you manage, that you can live with, and there are some amazing tools out there, including the Get Healthy Clark County website, which I told you earlier. I love Rayleen Earney is with us from Southern Nevada Health District. That is an amazing website, and there's a lot of tools to help people manage their diabetes, no matter if it's type 2 diabetes, maybe a gestational for expectant moms, which we've had a case of that here in the building. Her doctor going to be looking to test her about every 3 years, and we're also going to want to watch that baby closer because of the gestational diabetes.
That's right. In my own family, I can share with you that my mom had my brother, and he was 10 pounds 2 ounces at birth. So any baby over 9 pounds at birth, that's also a risk factor for gestational diabetes. The blood glucose is higher than normal during that pregnancy, so they will watch the mom to make sure that her blood glucose isn't super high and manage that condition. But also, you're right, in the future, future, my brother, he's at risk of developing type 2 diabetes in his lifetime. So it's not only the mother, it's also the child who have the higher risk for developing type 2 diabetes. So even if genetically they're predisposed to that condition, those lifestyle changes are something they do have control over to try to manage better so that they don't develop that type 2 diabetes. And if they do, then use the tool that helps them manage it to avoid complications, because that's really what leads to the blindness and amputations and kidney disease. It's unmanaged diabetes.
Left unchecked. I did not know the thing about the big baby weight being a factor.
Absolutely, and I learn something new every day about this disease.
I'm sitting here learning stuff with you right now. With the diabetes, I was familiar with diabetes back in my teen years because my boyfriend's younger brother was diagnosed with type 1 insulin-dependent diabetes.
People with type 1, their bodies cannot produce insulin, so you can be diagnosed at any age with type 1. And also type 2, the same thing, that used to be seen as an adult onset diabetes, but now even children, if they have the lifestyle issues and being overweight, puts them at higher risk for developing type 2. So you can't tell if a person says they have diabetes, it could be type 1 or type 2. It's just whatever's been diagnosed by their healthcare provider. We all need to eat better and be active, but also just know both of them need to be managed to avoid complications.
My way of managing things is movement is critical for the ongoing health. As far as managing diet, I've always been a big believer in getting fruits and vegetables, getting the right amount of protein, making sure that the carbohydrates are complex so that it takes longer for my body to turn those into sugars, because I want to keep the overall sugars in the diet managed.
Absolutely. And what they say, too, I used to teach classes, and to have that even amount of blood glucose, that is so crucial because a lot of us do highs and lows. The eating patterns, and when we're stressed, certainly that's another thing, raises cortisol in our blood. And that physical activity, that movement you talked about is so crucial because that helps us manage our stress as well. So in our programs, for example, the online diabetes prevention program, we have a section that talks about stress management and how important that is and how to manage that. And physical activity is a natural stress reducer. We just forget about it just to take time out of our day to walk more and just all those things that go with physical activity. Wear a pedometer, a step counter. Some people have Fitbits, and you don't have to go to the gym. You can do more things naturally if you like. Walking after dinner with your family, playing a little frisbee at the park. There's so many things you can do.
Seriously, people who work at a desk all day long and have very sedentary jobs, their risk is higher for all kinds of problems, including things like type 2 diabetes, because you need to get up and move to be able to manage all of these factors that can come into play. It's not just diet, very, very critical part of it, but it's also the movement. And one of the things that I'm constantly showing people right here in the Beasley Media Studios, we go off to the performance room where we've got chairs with arms, and I go, let me show you a really good trick. If you're sitting at your desk all day, get yourself away for a little break. This just takes a couple of minutes. And I show them how I just sit down, get up, sit down, get up, out of a chair a number of times. I think this morning I did 25 at home before I came to work, among the other things that I've done. That's the sort of thing that really, really helps manage the fact that you're stuck at a desk all day. You can manage it.
That's right. I do the same very thing, and I do have a desk job, so I know exactly what you're saying. And for people who have limited movement, too, that's an excellent way to get them to stretching and also getting out of their chairs. Get up, talk to a coworker, go to their desk rather than emailing them. There's so many little things we can do, so that's excellent.
That's my favorite, the chair exercise, and it also helps to strengthen your core, and it's very, very important. We were talking about keeping the blood sugar more stable. That's a huge part of it. And once you figure out how to do this, and it's not that hard, you can go through your day and not have those dips. What I've found in the past is if you fall, not physically, but food-wise, if you fall, let's say you have a donut in the morning, and you get that sugar peak in your system, easily digested, your sugar levels go up. 90 minutes to 2 hours later, you're down off of that, and your body wants the same thing again. We need some more of that. You don't want that, seriously. I'm not saying never, especially now that we're just getting started in the holiday season. There are temptations out there, and it's only going to intensify. But as far as trying to keep it stable, instead of the donut, this is something that we plan. In my house, this is a big darn deal. Steel cut oats. I do the whole week's worth all at once, makes it easy. steel-cut oats prepared with peanut butter powder for protein. I had pumpkin puree in there, chia on top. Chia is a really good source of omega-3s, protein, some fiber for you. Chia, that's a word that I think people are hearing a lot these days. Chia absorbs like 9 times its weight in water. So chia helps to keep your blood sugar stable, because when that tablespoon of chia gets into your system with the proper hydration that you should be doing anyway, 1 tablespoon of chia expands to more than 8 or 9 tablespoons, which would be half a cup in your tummy, keeps you fuller longer, keeps your blood sugar more stable, gets you through the morning. And then when you're smart about your snacks, raw almonds, and you do a few of those later, maybe you'll do a hard-boiled egg.
Eggs are excellent.
Yeah.
Protein.
And it's not that hard. With serving sizes, too, are pretty simple when you start getting into it. You know that with peanut butter, it's good, but it is calorie dense. And so a serving of peanut butter is going to be about the size of a golf ball. It's going to be about 2 tablespoons. Take it and put it on a low-sugar graham cracker, and it's a treat. So
good stuff.
Yeah, there's a lot of things out there that you can do. I plan out the day, come in with my mug of green tea. People know here in the building that I'm seriously into pursuing health, but that's one of the things that helps me manage, helps me make sure that I'm not going to be at risk with an A1C level to tell me that I'm prediabetes or that I've gone into a situation where it's full-blown type 2 diabetes.
And you're a role model for others as well. So when you bring in that oatmeal, what works for you, and you share, then other people want to know what those tips are, and sometimes they start adopting them. If you're like me, we work in a small office, and they see what you're eating for breakfast, and I love oatmeal. That's my favorite meal to start the day, and I add a little cinnamon in it too. So
lots of cinnamon.
And nuts, of course, not a lot, but just enough, like
this
you said.
This week it's pecans.
All right.
Walnuts or pecans.
Change it up.
Yes, a little flavor differential.
That's right.
But yes, it's to be a good example, and I am constantly sharing. I've got a nice little eco-friendly cup. I've always got it in my bag, so I've got almonds, and I like to share information as well. I try to emphasize to people that it's not that hard to do, and I know that the Get Healthy Clark County website has numerous resources. In fact, you can subscribe to the newsletter, and every Wednesday in my email box, I get this week's recipe and different ideas. It doesn't cost anything at all, Rayleen.
No, it just takes your time to go to gethealthyclarkcounty.org and sign up for our amazing programs. We do have those tips and tools. Nutrition Challenge is what you're referring to, and that's a wonderful way to get more fruits and vegetables into your day. We also have Care for Life, and that's a brand new program we have, and that's for diabetes self-management. And we have a diabetes prevention program as well called Road to Diabetes Prevention. That also includes a lot of different resources.
If there's someone in your circle, and I know that there is, we are all surrounded by people who either have been diagnosed with type 2 diabetes, are dealing with some kind of the different forms of diabetes, the type 1, the type 2, the gestational. People around you are also at risk for this. You yourself, it truly can be prevented by taking the right steps. And it's a delicious way of living life. This is not depriving yourself.
Not at all. And certainly the lifestyle tips we've been talking about, they say it cuts your risk by more than half for developing type 2 diabetes. So I think the reward is certainly worth it.
We were just talking about oatmeal. I forgot to tell you that I put fresh sliced banana and frozen blueberries on there too to go with everything else.
Can't forget the fruit. That's wonderful. Change it up. Your favorite fruits.
It's easy to do, and you really should consider it. By the way, back home in Kansas, my uncle has type 2 and is very concerned about doing things right. I want him to also sign on to the Get Healthy Clark County website. I don't care if he's in Kansas.
That's fantastic. The more the merrier.
Anyone, anywhere can take advantage of these absolutely free resources. Love the idea about the 2 different programs, the Diabetes Self-Management Program and also prevention, keeping you from having to deal with type 2 diabetes because it can be a problem, as you said, left unchecked.
That's right. And we saw in our community that people sometimes didn't have time to attend classes in person. Let's face it, we're all busy. We have competing family responsibilities. And that isn't to take away from the programs that people do attend because I think they're fantastic. I promote those as well. But we tried to see what wasn't out there. And in our estimation, a free diabetes online prevention program is not something I had seen. So I thought, well, let's use our resources, bring things together. We put in there also diabetes resource directory directory that has information about low-cost clinics and free clinics, help with medications, diabetes specialists, websites, just the whole 9 yards. That's part of our prevention program. We also address the healthy eating tips that we've been talking about and physical activity as well. So that one is a 6-session program, but you go at your own pace. There's no rush. You can sign on at 3 o'clock in the morning if you choose to, or after work. It doesn't matter when. It's just a tool that's there to help you prevent type 2 diabetes if you have prediabetes or even if you're at risk for developing type 2 diabetes.
Rayleen Earney is with us today on Talking Solutions from the Southern Nevada Health District. Maybe we should put this into context about the number of people amongst us who are at risk of developing type 2 diabetes.
Nationwide, it's 86 million people pre-diabetes. So that means that those folks have the condition in their blood where their blood glucose is higher than normal, but not yet high enough to be considered type 2 diabetes, not diagnosed as type 2 diabetes. But 9 out of 10 people don't know they have that condition. So until they go to an annual physical, get their doctor to take their blood test, whether it's an A1C or a simple fasting blood glucose test, it's at that moment when they get the results back and hopefully their providers are telling them that they're at risk for developing type 2 diabetes. So giving you an example, a normal blood glucose fasting test is less than 100 milligrams per deciliter. You don't have to remember the mg, dl, just the 100 number is important. So if you have a blood test that comes back over that 100 to 125, that's that pre-diabetes level that we're talking about. Higher than normal, but not yet in that diabetes category to be diagnosed as type 2 diabetes. That's an important time to look at all these classes. And even before that, don't get to where you're in type 2 if you don't have to be. That is where people talk about reversing the condition because you can do something about it with those lifestyle tips. So like Terry said earlier, it's not a death sentence. When you have that condition that's pre-diabetes, then you go ahead and you do all these things to keep your blood glucose stable, because genetics certainly play a part. We're not ignoring that fact. We can't do anything about our genetics. We can do something about the lifestyle tips we've been talking about.
The numbers are ridiculous. It says here, 1 in 3 people. That's how that millions and millions that you were talking about a moment ago.
1 in 3. And we all have hundreds of Facebook friends, or even in our offices, we work with a few people, then 1 out of those 3 would have pre-diabetes, type 2 diabetes. We talked about pre-diabetes, but it'll be 1 in 3 developing type 2 diabetes if we don't change our focus. Right now, here locally, we have about 1 in 10 people diagnosed with type 2 diabetes. And type 2 is the most common form of diabetes.
I call that my soapbox issue. And it's not an issue of laying blame at anybody's feet. It's just what you deal with. And the fact is once you go past that pre-diabetes stage and you are now diagnosed with type 2 diabetes, which is all too common, that's what I consider an epidemic. It's only increasing. We can turn this ship around. It just takes a little bit of work to do that. But when you're in a pre-diabetes situation, it can be reversed. You need to take some steps because you don't want to have to deal with the consequences that come with the diagnosis of type 2 diabetes.
That's right. It's just so much to manage when you do have type 2. Always worrying about your blood glucose, testing your blood sugar with your kit and those types of things, going to doctor's appointments more frequently, making sure your vision's okay because certainly in foot complications, nerve damage, having pins and needles, the numbness in your feet is certainly a concern. All those things get worse, wounds that don't heal with type 2 diabetes. It's just not worth it. If you don't have to go there, don't. But if you do have that diagnosis, that's still not even a death sentence. Manage the condition. We have all the wonderful programs at your fingertips. We have some on our website, gethealthyclarkcounty.org. We just launched a brand new Care for Life program for those who have been diagnosed with type 2 diabetes. That program, it's really something they can access on their smartphones or even online on the website. You can join for free because we got a grant and we're really happy about that because we wanted a tool to help people with their type 2 diabetes. And this is wonderful. So people can opt in for this program. We're working with 6 different clinical partners and 1 diabetes support group even. It's been wonderful. They sign people up for free and then the person gets a text message to confirm their participation. If they choose to go that way or sign up online, they get a confirmation. And basically they can set weight and exercise goals. They can tell us how well they're doing with their blood glucose. It's interactive. It's like having a health coach really at your fingertips. Let's say you're tracking your blood glucose. It will prompt you. It will set goals and say, okay, well, if your doctor told you to monitor monitor your blood glucose, tell us what it is, and test in the morning and test, 2 hours later. In your phone, you just text the number, whatever it is, 100, 135, whatever, and then it tells you if you're in range or if there are things you can do to help you manage better. It will send you recipes, also physical activity tips to get you going. So it's just one of those tools that I just think is fantastic.
And it's free. Free.
That's my favorite part. We love that word free.
That's everybody's favorite part.
We just want more people to use the program because not a lot of people know about it.
Yes, and even though the website is gethealthyclarkcounty.org, you don't have to be in Clark County to use it. I don't care where you are. If you're dealing with this, odds are you might be dealing with it. 1 in 3?
It's a lot of people.
You definitely want to avoid it, and there's ways to prevent. And for the people around you that either have been diagnosed or at risk of being diagnosed with things like type 2 diabetes, this helps in a tremendous way. I get excited. You can see me hands in the air and
me
the
too.
whole thing. If you can avoid being diagnosed with type 2 diabetes, that's where you want to go. You don't want to have the little meter you were talking about and having to do the ongoing testing of your blood sugars. Let's just keep you out of that if we can. We can manage this. A lot of times here at the radio station, people will bring in treats. There's always something over here. When somebody has a frosted sweet cupcake, after the fact, usually what I do is jump up and go, now listen, you just took in something that has a lot of grams of sugar. I would suggest, let me open up my little container of almonds. I realize that these are calorie dense, but I'm going to ask you to follow that sugary item with a few almonds because almonds give you healthy fats that slow the absorption of the sugars. What I'm trying to do is be preventative. I don't want your blood sugar spike to be as bad, and I can help you with that.
That's a smart tip, and we do suggest that as well. If you have apple slices, have that with peanut butter or almonds, like you said. So having that protein with that sugary carbohydrate makes smart sense. And there are easy things that you can grab, whether it's celery and some hummus or whatnot. Just those simple snacks so that you don't feel like you're hungry during the day. Those small nutritional breaks, let's call them, are certainly great. And it helps you keep your blood sugar level even, like we were talking about.
A lot of easy fixes out there. One of the things that I saw on gethealthyclarkcounty.org website a little while ago, they were talking about healthy snacks. The first thing that it listed was cottage cheese. And guess what's in my bag waiting for me a little later?
A lot of protein.
A lot of protein, calcium. So many reasons it's a good choice with some whole grain crackers and a few almonds. I believe in balance and making sure that you get something into your system every couple hours. I don't want you to have those highs and lows and peaks and valleys as far as your energy is concerned. And it doesn't have to be that way. And it's not hard.
Not at all. The thing I think we forget about, and I've been guilty of this myself, are the beverages. It is holiday time and we all like to drive through and get our lattes and all these wonderful things. Just remember that those have sugary calories as well, and the larger sizes have even more sugar and calories. So if you opt for your treat, treats are great, like we've been talking about, once in a while, but not an everyday thing. And also go for the smaller version of whatever you're getting. That will help you a lot. Drink more water.
Absolutely. I do a lot of green tea. You need to look at the nutritional facts on these items that you pick up. I was at a family gathering a couple years ago. Sister-in-law loves, it starts with frap and ends with chinos. She's got this little bottle. I flipped it around and I looked on the back, and I'm telling you, this is not a large drink. 38 grams of sugar.
That's right. And you divide by 4, and that's almost 10 teaspoons of sugar in that one little beverage.
One of the biggest problems we have with kids these days, and I think it's starting to go the other direction, kids drinking big sodas. I know that some people get really upset, and this is a free country. Don't take away my 64-ounce sweet beverage. And don't even get me started on sweet tea. The amount of empty calories that we take in and the amount of sugar we add to our diet by consuming a lot of that causes real problems.
It does. And also those fruit juices as well. And some are not even 100% juice. But even the ones that are 100% juice, we really need to watch our portion sizes. So a small 4 to 6 ounce glass, period. And that's a real tiny amount. Most glasses are at least 12 ounces that would fit like a can of soda. And so we really emphasize the need to drink more water. We do live in the desert. We need to stay hydrated. You can drink a lot of it, no calories at all. That's something I try to balance with. I do like unsweetened tea or green tea, like you say, the unsweetened variety. That's certainly something that doesn't have any calories. If you add sugar to it, if you have to add it, add one little packet. There are things you can do. It's still better than having those sodas and also the different lattes and such that we've been talking about.
We talked too about some of these lifestyle changes that have a positive effect. I believe that any change should be gradual because I think it is slow change that really sticks. I'm constantly working to get the overall sugar intake out of the day, trending it down and down and down. It doesn't take very many days of going that direction when your taste buds actually change.
They do, absolutely. And then pretty soon you get used to less sugar. Maybe it was 2 teaspoons in your coffee, and then you gradually go down to 1, and then sometimes none. You're right. Our bodies really adapt to these healthier lifestyle solutions.
We just need to give them a chance.
That's right.
Just try, just a little bit.
One thing, don't overwhelm yourself. Just one simple thing can really make a difference.
Yeah. So in this holiday season, if you can just make small changes. Rayleen Earney is with us today from the Southern Nevada Health District. We're in the holiday season. The cookies, the chocolates, the sweets, the treats, the lavish desserts, they're going to be out there. But if you can just change it a little bit, when you are going for that slice of pumpkin pie, how about half a slice? There are a lot of ways that you can change and it benefits you.
Don't deprive yourself, just have a little bit.
I think it was years ago Dolly Parton said, and this was after this big weight loss, which she's maintained beautifully over the years. She said, you can have 3 bites of anything. Just a different way to look at it. People should get to the website for sure. GetHealthyClarkCounty.org. Wonderful website.
Thank you.
What have I missed here?
The only thing I've recognized that people don't know is about their benefits. And I just want to talk about that real quick. Medicare, for example, people don't know that diabetes self-management classes are a benefit of someone who receives Medicare. And maybe it's only 2 hours a year, but if you don't take advantage of that, how are you going to know how to make these lifestyle changes we've been talking about? And whether it's your health plan, even if folks aren't on Medicare and they just have a health insurance plan, know what those benefits are. There are classes out there that may cover, and I'm not talking about our website because ours is totally free, but I mean our community partners. And I just want to give a nod to them because they do a wonderful job having classes. People don't know their medical benefits. They're not going to take advantage of those. And that's why programs close down. I really don't want to see that happen here in Southern Nevada or really anywhere else. These programs are crucial. So I really appreciate the time to talk about our website, GetHealthyClarkCounty.org. And we also have a Spanish counterpart, VivaSaludable.org. Please come visit. We'd love to have you.
One of the things with the Affordable Care Act over the past few years is that a lot of wellness services are covered. It's not just your mammograms and your annual checkup. It's also things like what you're mentioning, diabetes awareness classes that you can take, I would imagine, are also under that same umbrella.
They sure are.
We should do that. It makes a huge difference. If you don't have to deal with type 2 diabetes, or if you've already been diagnosed, there's ways to manage it. It's not that hard. And there are a lot of tools out there to help, including the website, all the things that you can find on GetHealthyClarkCounty.org. Anything else?
Gosh, we've talked about so much already. It's been so fun.
I know. I love talking about this. Go to the website. Make sure you share it with everybody. Southern Nevada Health District. A lot of benefits for those of us here in Clark County. You guys got a grant. It's helping you do things for people as far as diabetes awareness and management of the condition, hopefully avoidance and prevention.
And you just reminded me, too, that we do have apps on our website. Neon to Nature, that's an app that you can download off of your smartphone and see all the beautiful trails we have. We have natural beauty here in Southern Nevada, and people are taking advantage of going on hikes and bike rides with their families. That's a wonderful tool that's there. We also have farmers markets listed on our website. We have so many things and programs. The holiday challenge, we've been talking a lot about holidays. That's something you can go on, and every week you can be emailed a new tip. Sometimes they're very simple, like eat breakfast every day and then you just check off that you've done it and you're done for that day. They're just little reminders that you can get during the holiday season and throughout the year.
And through the website, the Wednesday emails that I get.
Nutrition Challenge, that's a program that I also run. And I know I send those every Wednesday.
Well,
so
I get them every Wednesday.
Get recipes. And
there is a way to log in your fruits and vegetables and actually be entered for some drawings, if I remember.
Monthly prize drawings at randoms. Sometimes they're small amount gift cards. We do send those out. We'll do a drawing each month. So you can't win unless you play. That's for sure. And it's totally free to join. Just go on our website, gethealthyclarkcounty.org, sign up real quick. That's an ongoing program we have throughout the year. Then our counterpart is Walk Around Nevada. So there's a physical activity program that you can sign up on that same website. Gives you tips about Nevada that you can learn and safety tips. They also do their own prize drawings. So you can't lose. We're out there. So we just want to make sure you're aware of our wonderful programs.
You want to talk win-win? Free website, free apps, free programs. And some of the programs even have prizes. This will make our holidays a lot easier. Rayleen Earney from the Southern Nevada Health District. Very informative. Thank you so much for joining us today on Talking Solutions.
It's my pleasure. Thank you.
Talking Solutions is a production of the Community Relations Department here at Beasley Media Group Las Vegas. Get more information on today's topic on our Talking Solutions page on Facebook, where you will also find links and a podcast of today's show. Thanks for listening, and have a great week.